like everything else in anatomy phys, the GI system pretty much is from mouth to anus, depending on most of the organ systems of the GI are in the abdomen, and that's where we'll be diving into in a little bit. Everything digestion begins in the mouth, chewing process called mastication, and then we do start having some other digestive properties going on inside the mouth. Usually, it's most of your um, glucose type foods, your starch, all that stuff is really broken down, and you also do have absorption in the mouth, i.e., your oral glucose. Okay, that's why we give it that way for those type patients because you can absorb some of the sugar and all that stuff. It's broken down and then absorbed in the mouth and then down the rest of the the side of it. Digestion, pretty much it's the parasympathetic. This is your rest and digest. Remember that? Okay, so it's the predominantly coming from the vagus nerve down. Um, there's also multiple other hormones, pepsin, cytokines, and all that stuff that help with the motility system. I'm really not going to talk much about that. The esophagus or esophagus, depending on who you talk to, it's usually a collapsed um, organ system, but then from there it does allow for movement. And what is the movement term called going down the esophagus? Swallowing. But then from there, what's the forward propulsion of food is called starts with the P, peristalsis. Okay. One of the problems, though, of course, when we are potentially the airway, BVMing, and all that stuff, since it is a hollow organ, there's nothing that really stops air going into the esophagus, which goes down into the stomach, which then goes down into the large intestines, our small intestines, large intestines. Okay, so that's how we get our gastric distension and all that stuff with positive ventilation. Peristalsis, and then from there. Down at the bottom of the esophagus is where the portal vein is kind of sort of intertwined along with the vagus nerve. There's two branches of the vagus down in that, but don't worry about that. In the portal vein, the purpose of that, when we talk a little bit later, was cirrhosis and the bleeding and all that stuff is because of that portal vein system, or it's called anastomosis. It's a low pressure system that can actually back upwards from the liver, which expands the blood vessels around the lower esophagus. Okay, so what happens when those blood vessels break? So cirrhotic patients, liver failure, blood vessels, they're known to have problems with. Okay. So the blood vessels break. What do? They bleed. Okay. So this is your esophageal varices stuff. Okay. They throw up the blood and they can die from it. All right. We'll talk about more like that in a little bit. Um, food goes through the cardiac sphincter. Unlike the pyloric sphincter, the cardiac is not a true sphincter where it's a muscle. The cardiac sphincter is actually really more along the diaphragm, or it's the diaphragm that kind of sort of holds and holds it together and pulls it together. Um, with that, if the diaphragm kind of breaks apart and moves, the esophagus, the stomach, and all that stuff can go upwards, and that's where we get hiatal hernia. And that's also the aspect of with people with reflux, GERD, and all that stuff. That's where they hit the feeling of having chest pain for that exact same reason. Because to the stomach, there's what's called proteases, which are the digestive enzymes. and then hydrochloric acid. The hydrochloric acid drops the pH down, which allows for the proteases to work. But then from there, the hydrochloric acid, that's one of the immune system, part of the immune system of controlling the bacteria. All of that's kind of sort of tossed around into the stomach, and then ultimately it goes away from quote unquote food to a product called chyme, and the chyme then goes into the small bowels. Questions thus far? Anatomy review. All right. The other important factor for the stomach and all that stuff is the intrinsic factor here, which is released from one of the two different types of cells in the stomach. The intrinsic factor is with vitamin B12. All right. It binds to B12, which in turn allows for it to be absorbed into the small intestine. All right. The problem here is some of your bariatric surgeries, okay, they kind of sort of take out the top part of the stomach when that's where the intrinsic factor is produced. So we have a lot of patients that have the potential of having B12 deficiency, and B12 is part of the nervous system and also blood production. So think about and all that stuff. It's also your alcoholics. They have problems with this too. Or I should say drunks. Alcoholics quit and go to meetings. GI systems, again, the whole purpose is to absorb the digested food. Duodenum is connected to the liver, gallbladder, and pancreas. Whole bunch of different ducts and all that stuff. And then the pancreas, the whole purpose of that is it's the major thing of releasing enzymes to help break down some of the protein and some of the fat, and then also it helps neutralize the acid that's coming into the small intestine. If not, it would burn all the way down and go from there. Small intestines, three parts, 90% of absorption, duodenum, jejunum, and ileum. The duodenum is this little first part here from the stomach coming down, and then you have at the ligaments of Treitz all the way down till almost the very end is the jejunum, and then the terminal part is the ileum, which attaches to the cecum, and that's where the appendix is. We'll show that in a little bit. Pancreas here looks like a football. The tail is nestled into the spleen. The head is actually, the duodenum is buried through the head of the pancreas. So a lot of people that have pancreatic cancer, which we won't talk that much about, a lot of times they talk about the duodenum and all that stuff. The gallbladder or the bile duct goes through the pancreas. So again, with the pancreatic cancer, they take all of this part out through what's called a Whipple procedure. Liver produces bile. The other portion of it is detoxifying drugs. That's really the good thing. You can live with about a quarter of your liver before we start really dying and all that stuff. The liver is the only organ in the body that actually cut it in half, as long as you have blood supply and transplant it, and it will grow back. So it's a very remarkable aspect. What's the other major thing that's the liver? What else does besides the vitamins and minerals, what else does the liver store that is really important for us? Fat, some part, okay. Something else. Diabetics need it, okay. It doesn't store it, and it's produced in the pancreas, but it's something that the insulin tells the liver to break down. Glucose through glycogen and all that stuff. So you basically have that the glycogen is broken down into glucose, and then from there allows us to increase our sugar. So patients that have liver, okay, they don't have that. Thereby, if you give them different types of medications to help increase the glucose, it doesn't work. All right, gallbladder. The only real purpose of the gallbladder is to store the bile, which in turns it gets emptied out. So the liver produces the bile, sticks it in the gallbladder, and then anytime you have fatty foods, um, pushed out. And the whole purpose of the bile is to what's called emulsification of the fat, break it down into little smaller pieces. And when we know that smaller pieces are more easily broken down and all that stuff. Pancreas, 6 inch, sits across the back of the peritoneum and all that stuff. On the right side, again, attached into the duodenum and all that stuff, tails into the spleen. Um, and its really purpose is it has two different things. One's exocrine, which is the all of the digestive enzymes, and then the endocrine system, or going back when we gave that talk a year ago, with the insulin and then the glucagon. Um, where, sorry, made a mistake. Insulin builds up on the previous two slides. Glucagon is the one that tells the glycogen stores to be broken down. All right. And glucagon is one of the medications that in the future I'm going to do a study on with EMTs to be able to give intranasally to see if we can test and all that stuff. Because it's not one of your medications that you can give but as an advanced EMT. EMTs cannot give intranasal glucagon. Yeah. Yep. It's no worse than Narcan up the nose. Well, I mean, if these people have a sugar of 15 and they're unconscious, colon, large intestine. The whole purpose of the colon is really to absorb the majority of the colon from the cecum on up over to the descending colon is really to absorb water. And then the last portion of it, the sigmoid colon, is a storage for feces. And then the anus or the anus, all the anal and all that stuff, this is the terminal portion of the GI system. Absorb water, do have some bacterial digestion occurs, and they say it can take anywhere from 8 to 72 hours after you eat food to go from the mouth to the anus, depending on what it is. Blood vessels, there's a whole bunch of different things in here, depending on which, basically every organ has at least two blood supply coming to it. Not going to really bore you with all that stuff. But the big thing to draw a conclusion on is the aorta in the inferior vena cava goes straight through all the abdomen. Portion right here is called the bifurcation, and that's the belly button. Okay, so couple things with this. Of course, if patients are complaining of abdominal pain around the umbilicus and all that stuff, elderly patients, things to think AAAs or the abdominal aortic aneurysms. All right, and with pregnant females, why is that so important? Why is this region so important? Okay, baby lays on it at what age or what station? Second trimester. What part of second trimester? So 20 weeks. All right. 20 weeks is that magical numbers. That's when the uterus is big enough that it can actually start sitting on your aorta and the inferior vena cavas. Okay. That's why after 20 weeks we put them in the left lobucubitus position so that they don't compress that and develop IVC syndrome. And we'll be doing pregnancy again in the future. Whole bunch of blood vessels, again, from the aspect of the hepatic veins up around the esophagus. They kind of sort of attach there, along with blood supply coming from the esophagus down. And that's where you get the portal, what's called the portal naval anastomosis. And then down in the rectum region, it's the same thing. You have blood supply around the anus, along with some of the blood supply from the legs going up, and you have a anastomosis, naval anastomosis system here. I mean, that's the majority of the reasons why patients have hemorrhoids with liver failure. Again, these are low pressure systems that allow for the blood vessels to expand open, and then from there burst and have problems and all that stuff.